Hello everyone. In this tutorial, we will talk about identifying and managing bias in medical research. And this will include mainly two topics. The first is understanding what is bias in research, and the second is about the different types of this bias. We will remain with techniques to identify this bias in critical appraisal, but we can leave this to the next tutorial. So let's start by identifying what is bias. Bias in clinical research refers to systematic errors that can skew research findings. Managing this bias is very important for conducting reliable and valid research. Considering that bias can occur at any level in the research process, from study design to data collection to analysis and report. So, understanding different types of bias and how they influence research outcomes is very crucial for conducting high quality critical appraisal. So, let's start with this topic, the various types of bias, and one of the most common type is the selection bias. Selection bias occurs when participants included in the study are not representative of the target population. And this can result from non-random participant selection or from systematic exclusion or inclusion of specific groups. An example for this is in a clinical trial for a new drug. Excluding elderly patients, for example, can lead to results that are not really applicable to the broader population, particularly older adults, who may have different responses to treatment. There are two important considerations when we talk about selection bias, including sampling frame issues, because the frame used to select the sample can introduce bias if it excludes certain segments of the population. For example, using a hospital registry that only includes certain geographic areas, this can lead to overrepresentation of certain or specific demographics. And another consideration is the voluntary response bias, and this occurs when individuals who volunteer to participate in the study differ significantly from those who don't volunteer, often because volunteers are more motivated or interested in certain subject related to the study topic. Another type of bias is the information bias, and we can divide it into two types or subtypes. The recall bias, and this type occurs when participants do not accurately remember past events. And this is often seen in retrospective studies. For example, patients with a certain disease might recall their exposure to a risk factor differently than healthy controls. The second type of this information bias, they call it interviewer bias, and this happens when the person collecting the data influences the responses of the patient, either intentionally or unintentionally. And this can occur through leading questions or even body language that suggests a preferred answer. There are two important considerations for this type of bias. The first is misclassification bias. Misclassification of exposure or outcome status can lead to biased estimates of the effect. And this can be differential or non-differential. Differential when it is related to the exposure or the outcome, non-differential, it is unrelated. And with differential misclassification often leading to more serious distortions of the results. The other important consideration is measurement bias, where inconsistencies in how variables are measured can lead to this type of bias. For example, using different methods to measure blood pressure in two study groups, this can introduce systematic differences that are unrelated to the actual intervention. The third type of bias is the performance bias. And the performance bias can be defined as this type of bias that arises when there are differences in the care that is provided to different participants in different groups in the study. And this care is different or additional to the intervention being studied. And these differences can influence definitely the outcomes of any study or research. For example, in controlled trials, participants in the treatment group might receive more frequent follow up visits or better overall care, and this could lead to improved outcomes unrelated to the treatment itself. So, this is called the performance bias. We have here to consider again two important points. The first is the co interventions. Additional treatments can be provided to the participants in one study, and these treatments are not part of the study intervention, and this can introduce this type of bias. The other one is the adherence. Differences in adherence of the intervention between different groups can also lead to biased results. And this is particularly relevant in studies where the intervention requires significant patient involvement, such as lifestyle modifications, for example. The fourth type of bias is the detection bias, and this type occurs when there are systematic differences in how outcomes are assessed between study groups. This can happen if outcome assessors are not blinded to the intervention. So they know which patient is taking the placebo or which patient is taking the intervention or the treatment. And this leads to differential outcome assessment. Example for this, if researchers know which participants received the experimental treatment, they might be more inclined to report positive outcomes for those participants. And this is a very common instance that happens in clinical trials or in open label clinical trials. There are two important subtypes or considerations. The first is the differential surveillance. This occurs when participants in one group are monitored more closely than the other, and this leads to frequent detection of outcomes in this specific group. An example for this is our patients in treatment group might receive more frequent diagnostic tests, increasing the likelihood of detecting adverse events. And this is why the randomized controlled trials are more credible than the open label studies, where everyone knows which patient is taking the experimental medication and which patient is taking placebo. So, unintentionally, some additional care or sensitivity towards reporting outcomes may be inclined towards the group that is taking the experimental medication. And another subtype is the ascertainment bias, and this is related to detection bias, which occurs when the outcome is diagnosed more frequently in one group due to more examination or more follow up. The fifth type of bias is the attrition bias, and this can result from systematic differences in withdrawals or exclusions of participants from the study. If participants drop out of the study at different rates than different groups, it can lead to this type of bias. Example, if we have more participants dropping out from a controlled group than the treatment group, it may appear that the treatment is more effective than it actually is. Two important considerations when handling missing data. Different methods of handling missing data. Last observation carried forward, for example, multiple imputations. This can affect the study results and introduce bias. And this is important to understand the implication of each method. The their protocol versus intention to treat analysis is a very important consideration here. Attrition can impact the results depending on whether the analysis of the study is based on the per protocol population, those who completed the study as planned, or the intent to treat analysis. And here we analyze or look to the results to all participants as originally assigned, including those who dropped out. The sixth type of bias is the reporting bias, and here reporting bias occurs when only certain outcomes are reported, typically those that show statistically significant or positive results, while other differences or other outcomes are unreported or omitted from the results. And a study may only publish results that support the efficacy of a drug without mentioning the safety data. Of course, this is a biased reporting bias. Another important consideration in reporting bias is the selective of the subgroup analysis. Often, only favorable subgroup analyses are reported, while those that show no effect or harm are omitted. And this leads to incomplete understanding of the intervention's effects. Outcome switching also can happen when changing the primary outcome of the study data begins can introduce reporting bias. So changing the primary outcome of a study after data collection can introduce reporting bias. How? This happens when change in the primary outcome of the study is made based on results observed from an interim analysis, for example. The seventh and the last type of bias that we will discuss today is the publication bias. And here we refer to the tendency of studies with positive findings to be published more frequently than those with negative or inconclusive results. And this leads to skewed perception of the evidence base. There is an important consideration, which is the funnel plot analysis. In meta-analysis, funnel plots can be used to detect publication bias by plotting study size against effect size. An asymmetrical funnel plot suggests the presence of publication bias. There is also what we call the gray literature, and here incorporating unpublished studies, conference abstracts, and other non peer reviewed sources into the review. And this can help mitigate the effects of any possible publication bias by providing more comprehensive view of the available evidence. So it has two sides, good and bad, because you are adding non-peer reviewed sources to an evidence. So it needs some sort of clinical judgment or critical appraisal view. So these are the seven types of bias with their subtypes that we can encounter in medical research. Let's now summarize the techniques that can be used to identify bias in different studies. And here we will focus on the study design, the data collection methods, and the strategies for managing and mitigating the biases. So let's start with evaluating the study design. And here we will look into three areas: randomization, blinding, and control groups. For randomization, we need to ensure that participants were randomly assigned to groups to minimize selection bias. And also, we need to evaluate the randomization sequence generation and its concealment. And this is an advanced technique. When it comes to blinding, we need to check if blinding was used to prevent performance and detection biases. And also, we need to assess the impact of blinding on both subjective and objective outcomes. And if we are doing the critical appraisal of the publication or the research findings, we need to focus on this. This is one of the most important areas that can evaluate the credibility of the research conducted. When it comes to control groups, we need to confirm the use of control group treated similarly to the intervention group, and to consider the effectiveness of blinding and comparability of controlled and intervention groups. After evaluating the study design, we move to review the data collection methods. Two important areas when it comes to data collection. First, the consistency, and second is the objectivity. The consistency, we need to verify that data were collected in a consistent manner across all participants to avoid any information bias. And when it comes to objectivity, we need to ensure that the data collection methods were objective, standardized, and were done in a way to reduce the risk of any interviewer or detection bias. Also, we can assess the validity and reliability of measurement in instruments in the study and the timing of the data collection. This can also make a difference or make a bias. The third point that we need to look at after the data collection method is the attrition and reporting, and we need to analyze both. So, first, we look at the dropout rates and compare the dropout rates between study groups to identify potential attrition bias. And we need also to look at the outcome reporting. Investigate whether all the pre-specified outcomes were reported to prevent reporting bias. And also we need to consider how missing data was handled and scrutinize any post hoc changes to the study protocol. Now let's see how can we use advanced strategies to manage bias. One, through randomization and blinding. So, implementing randomization and blinding to minimize bias, and use cluster randomization or blinding in complex interventions to further reduce bias. Or using control groups by incorporating control groups to account for placebo effects and confounding factors. And researchers can use active or historical controls when necessary. But be aware of the potential biases that may introduce. So being aware of the potential biases, it will help researchers to minimize the possibility of them to happen. Also, researcher can conduct sensitivity analysis. And sensitivity analysis can be conducted to test how robust the findings are and identify potential biases. Another important question is how to assess confounding, and this can happen by identifying and controlling uh, all the confounders to avoid false associations or obscuring true relationships between different variables. When it comes to control groups, we need to check if the control group was treated similarly to the intervention group. And also, we need to consider the effectiveness of blinding and comparability of control and intervention groups. After evaluating the study design, we will move to review the data collection methods. We need to check if data was collected in a consistent manner across all participants to avoid information bias. And also, we need to check the objectivity of these data collection methods. So, to ensure that these methods were objective, standardized, reducing the risk of the interviewer or reducing the risk of the detection bias. It is also important at this stage to assess the validity and reliability of measurement of the instruments used in different measurements and the timing even of data collection. When we finish the data collection and its evaluation, we move to analyzing the attrition or reporting. And we start here by looking at the dropout rates. Compare the dropout rates between the study groups to identify any potential attrition bias. And also look to the outcomes of reporting. Investigate whether all the pre-specified outcomes were reported to prevent any reporting bias. And here we can also consider how any missing data was handled, and we can scrutinize any post hoc changes to the study protocol. So that's how we can detect any type of bias while doing critical appraisal. Another important question that we need to answer is how to manage bias in medical research. What are the advanced strategies that researchers can adopt in order to minimize the possibility of bias? The first and most important is randomization and blinding. So the researchers or the study implements randomization and control blinding, this will minimize bias. And that's why randomized control trials are the highest in the evidence pyramid. Also, we can use techniques like cluster randomization or blinding in complex interventions in order to make it even more or to reduce the possibility of having bias even more. Using control groups is a strategy to reduce bias as well. Incorporate control groups to account for placebo effects and confounding factors. And here, researchers can use active or historical controls when necessary, but they should be aware of any potential bias they may introduce. Sensitivity analysis is another strategy in order to ensure that we have low bias in the control methods in or in the study. This includes perform analysis, sensitivity analysis to test how robust the findings are. And finally, addressing any confounding factors by identifying them and controlling them to avoid false associations or obscuring true relationships between different variables. So, this is for today. Thank you very much. We discussed the different types of biases. We mentioned seven of them, the techniques to identify them, and also the strategies to prevent them from happening or to reduce the possibility of these biases.